Welcome to the Hair Loss Show, where two of Australia's leading hair restoration surgeons, Dr. Russell Knudsen and Dr. Vikram Jayaprakash, discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome to the Hair Loss Show. My name is Dr. Vikram Jayaprakash.
I'm Dr. Russell Knudsen.
And welcome to episode number 8 in our series of stimulator therapies. In the last episode, we talked about minoxidil and went through in quite depth and detail about the role of minoxidil as a stimulator therapy. Today, we're going to go and talk about something that's not been around for as long, which is low-level laser therapy, which essentially is another form of stimulation therapy, and there are a lot of devices on the market, and we'll sort of try and break that down and unpack that a little bit. But in essence, low-level laser. Why does it work? What is it doing?
All right. So basically, when people think about lasers, they think obviously about resurfacing lasers that can use carbon dioxide or erbium or YAG or things like that burn and have a thermal effect, which means a heat effect upon the skin, which is meant to regenerate the collagen and elastin fibers. This is completely different. We call it low-level laser therapy because we're doing it at a much lower power level, and also we're using a different wavelength. So all of the devices that are in the market, they've been in the market now for over 10 years, work on the principle that there is a frequency of the laser wavelength that has a stimulatory effect upon the hair follicle, which really turbocharges energy production in the follicle without trying to get in the cell, without trying to get too technical. It just increases production of energy in the cell, which means it's got better metabolism in the cell. This is making a healthier cell. So the idea is to make the cells in the follicle healthier by producing more energy, make them more robust, if you like. So basically, we use it in the red light spectrum. If you think of a rainbow and how you have different frequencies. So 650 is the wavelength, micrometers, the wavelength that every device uses, because that's in the stimulation part of the spectrum. And we only use a very low power called 5 milliwatts. So this cannot create a thermal effect.
So you don't want to burn the scalp.
We're not going to burn the scalp. Right, so yes, you can leave it on too long and make it uncomfortable because of the heat, but that's just the heat of the device, not the thermal effect in the skin. So the first thing to emphasize is it's completely safe. So you cannot damage the hair in normal use of the product. You cannot damage the skin in normal use of the product. You cannot burn yourself in normal use of the product. And this is what makes it attractive. So basically the first device into the market used the wavelength of 650 with a power of 5 milliwatts and came in a comb device. So the idea was that you combed through the hair and that the device would allow this red light to actually come over the scalp. Remember, like we talked about with minoxidil, we're not trying to get the light into the hair, we're trying to get the light into the skin, because all of the hairs on the scalp are generated within the skin.
But this comes to another point as well, and it just reiterating the point that if you've got someone who's shiny bald, all right, combing a laser comb or wearing a laser cap is not going to do a damn thing for you. The goal with low-level laser, as with all stimulators, is to stimulate the existing hair. We're trying to thicken up that hair shaft diameter. So you need something there for the laser to work on.
I've only ever seen one photo in my life of what was ostensibly a balding person use a laser therapy and get a full head of hair back. Right. So that was a unique response. But if you look at the way the energy works in the skin, we've been studying lasers for over 50 years. There is a dose-response curve, like we talked about with minoxidil. There's a dose-response curve for laser, and it goes like this. And it actually goes into a negative territory, which means that in theory, if you had too much laser going on, you would actually get an inhibitory effect instead of a stimulatory effect. But the reality is you'd have to wear this thing almost constantly to get into that territory. So basically, it's highly unlikely that anybody would get the inhibitory effect from this dose response. That said, the different devices come in at different levels in this dose response. Right? So even though they're all really using red light at this wavelength and really using power, it depends upon the quality of the diodes that you're using in the device. So the weakest effect comes from the combs. The next weakest effect comes from the bands that you have to sit on here and then move the band to different areas like that. But probably the best device that ensures compliance, which is the secret, is a home use cap device. There are clinics that we've seen before that actually supply lasers on stands that you can go into the clinic and do it. The problem with that is getting people to go there frequently enough for it to have an effect.
Doing it once a month is not going to be any.
It's a waste of time. It's a waste of time doing it once a month. If you're really going to have an effect, you have to do it more frequently than that. Our best current advice is that you need to do 3 sessions per week, 3 times per week, which is why home use is very, very handy. And it needs to be at least greater than 30 minutes. So I'd say something in the 30 to 45 minute range would be ideal, 3 times a week. So it's a lovely way to do hair stimulation, because for people who don't want to put chemicals in the system or worried about whether they're going to get a reaction to using the minoxidil, for example, they want to do something that doesn't require having to take a pill or have injections or something else like that. This is a very easy thing to do. There are many devices in the market, and the pricing largely depends upon how many laser diodes there are in the cap, if we're talking about cap devices. There are caps that are sold to anybody, to the consuming public, if you like, through companies. There are also caps that are only sold by physicians, by doctors. That's a high-grade, high-quality device that has a bigger energy output. So in fact, those devices that are doctor only prescribed are up at this end of the scale. And so they are a little bit more expensive, although they're trying to provide different versions now. But realistically, people can get devices for a couple of $100 or $500. They don't work as well as the devices at the $1,000+ end of the marketplace.
So I mean, so just so that everyone knows, I mean, if you're going to get, say, a really good cap device, because I think we've highlighted that caps are probably better than combs,
yes,
right? And caps are probably, if you're going to have a low-level laser, caps are probably the gold standard, because better than going, I'm sure the systems with the stand and where you go to clinics and have the treatment are great.
But the beauty of the cap also is it's on a rechargeable battery.
That's right.
So you can wear that
baseball cap.
That's right. You can put a baseball cap over it. You put the battery, the rechargeable battery in your pocket.
Carry on with your normal day.
And you can cook, read, watch television, take the dog for a walk, all of the above, right? It really doesn't restrict your life at all, and that's the beauty of it.
It's very portable.
You're going to need to spend $1,000 for a top-end cap, and is it worth it? Yes. Why? Not because it's got a brand name on it. You're getting a better quality diode, you're getting a better quality energy output. None of the devices quite match what appears to be the peak response, and the reason that would be is that if you put them on, we do it pulsed, right? The best ones work on pulse, and the reason they do it as a pulse is because it dissipates heat. It lets the heat escape from the cap, which means that you don't get such a heat buildup on your scalp and make it uncomfortable. So for example, you could do this as a pulse device. You couldn't wear it that long if it was a continuous device. Right. If you use it as a continuous device, you'd be lucky to be able to wear it more than 6 or 7 minutes because of the heat buildup in the cap.
But still, you're going to feel a little bit of heat on your scalp.
You will feel some heat on your scalp.
Minutes.
But it's not enough to give a problem. So we can't quite get to the peak level, but we can get significantly up the pathway to feel that we're getting a positive effect. The other nice thing about laser caps is that they've been properly studied. So in other words, we're not relying upon evidence by people saying, oh, I used it and I liked it. That's called anecdotal evidence. That's the lowest level of evidence, where people say, I used it and I liked it. I think it gave me a result. The lasers, like minoxidil, have been studied in properly controlled trials where people had half the scalp stimulated, half the scalp not stimulated, and they were able to measure, again, 2 things: improvement in the shaft diameter from the use of it, and reduce shedding, which means that the stimulatory effect means that more of the hairs are growing at any one time. So there's a little bit of increase in the hair numbers that will grow at any one time on the scalp, and a increase in the shaft diameter.
That's awesome. And so look, sorry, I just popped off camera because I thought we'd demonstrate it, have a look at the cap. So this is a version of it, and so as you can see, it's a dome. It's a hard plastic dome, and this fits inside a baseball cap. And you can see inside all the LEDs there that are going to fire off. It's attached to a battery pack that sits in your pocket, and this goes into a baseball cap, and you wear it and you walk around and
Let's do it.
yeah, absolutely. Well, so you can just wear it there, and you can. I think this is the cap that goes over the top, and then you can walk around.
Once you flick it on
With this. Well, I think this needs charging. It's not charged, but
okay.
But this will just carry on.
And nothing to see.
Nothing to see.
So basically, safe, effective, and just as importantly, Vikram, it works through a different pathway to minoxidil.
Yes.
So in other words, you can combine the therapies because you're not just doing the same thing. What you're actually seeing is that you're using one pathway for minoxidil therapy. If you want to add laser therapy in, you're going through another pathway. So at least in theory and potentially, you could get a synergy there and get an additive effect because you're doing it in two different ways rather than trying to duplicate the same thing. So short answer is, lasers have been properly studied. They are a credible form of stimulation therapy. They have no side effects that people are going to have to discontinue use for. Just like minoxidil, stopping you getting thinner is a sign of success, not a sign of failure. Not everybody who uses the laser cap is going to get improvement. Again, the figures are going to be similar to minoxidil in terms of the 40% that might notice improvement and the other 40% that might notice just stabilization. If you add, however, things like minoxidil and laser to therapy, it's entirely possible that 80% of people will notice an improvement, ranging from minor improvement to significant improvement. All stimulation therapies, including the next ones we talk about, work better in the early stages of hair loss, as you said at the start of this podcast. And that is that if you've got shiny, bald head, stimulation therapy is unlikely to have any significant effect. In any study that's ever been done in the world, if the hair shaft diameter decreased to less than 50% of its original shaft diameter, we couldn't make it into a healthy hair again. But to summarize, a very effective, worthwhile therapy. It's a one-off expense. Some of them, the physician-only caps, give you a 75% money-back guarantee in the first 12 months if you're unhappy. You get 3-year warranty on parts for it as well. So even though you may be spending more than $1,000 on it, you have the ability to sell it back to the company in the first 12 months. And you also have the ability, if there's a problem developing, to get it fixed for free in the first 3 years. I've been using it in our practice now for 7 or 8 years. And I could push it a little bit harder, but some people are fearful about it. But I really do think it's a very important part of our therapy options for patients.
Like everything, compliance is key, isn't it? There's no point in buying these things if they sit in the cupboard. They're not going to do a damn thing.
Well, so some of my patients take them overseas, right? They take them overseas on the plane with them, plug them in and do it because they need to be consistent. You can not use a stimulation therapy for a week or two and not have a harmful effect over time. But if you don't offer it for a month or two, you will definitely notice deterioration. So another excellent option available for you. Think that, yes, you could buy off the internet and it's cheaper if you buy this one and it's cheaper than if you buy that one, but you also got to think about the amount of energy that's being supplied to the hair follicles and the amount of stimulation that is occurring to the hair follicle. So get some proper advice about it. Don't just go on price.
Yeah, not all hair caps are created equally, isn't it?
That's right. I hope you've enjoyed this today's episode of the Hair Loss Podcast, where we're talking about stimulator therapy. And when we come back for our next podcast, we'll talk about the other therapies.
All right, thanks very much. See you next time.
See you next time.